Welcome to our office.
Welcome to our office.
This video will provide information regarding third molar removal, also known as wisdom tooth extraction.
The average adult mouth is equipped to hold 28 permanent teeth. However, by the age of 18, many individuals will have completed the development of their third molars. These teeth, usually 2 on the top and 2 on the bottom, are the last to develop in the back of your mouth. Since wisdom teeth are the last to develop, they frequently do not have enough room to erupt in the mouth. An oral and maxillofacial surgeon is a specialist trained to evaluate and treat problems related to third molar development.
There is rarely a functional use for these teeth, and when they erupt, it can often lead to problems in your mouth, such as misalignment of your other teeth, possible risk of infection, cavities on neighboring teeth, and pain. Sometimes a wisdom tooth can be impacted where it is trying to break out but remains stuck under the surface of the gum. Frequently, it may be growing sideways or is inhibited by a nearby tooth. A special X-ray of your mouth and jaws will be taken to determine if your wisdom teeth are impacted.
Removal of wisdom teeth is not often considered an emergency situation unless you are experiencing significant discomfort or an infection. Extraction is primarily a preventative measure to avoid long-term problems. We recommend that a patient get their wisdom teeth removed between the ages of 16 through 19. The timing is generally dependent on root development. If the wisdom tooth has less time to develop, the tooth root will be shorter and easier to extract from the mouth. The longer the wisdom tooth remains in the mouth, the more mature and often more difficult it is to extract.
Our surgeons are well equipped to handle all types of patients regarding the removal of wisdom teeth independent of age. However, if you are over the age of 30, we often advise that you wait to have your wisdom teeth removed unless there is a significant problem such as ongoing infection, cyst, gum disease, bone loss, pain, or swelling. The risks of removal may outweigh the benefits for some patients over the age of 30, especially if the wisdom tooth is under the tissue or under the bone, or if the wisdom teeth have fully erupted. Problems that require wisdom tooth removal over the age of 30 includes infection, jaw cysts, gum disease, bone loss, cavities, pain, or swelling. You will most often be referred to our office by your general dentist or orthodontist if you would benefit from having your wisdom teeth removed. We will ask that you come into our office for a consultation with one of our oral surgeons. We will provide you with pre-operative instructions to prepare you for the day of your surgery. These instructions are also available on our website. You should anticipate being in our office for an hour and a half to 2 hours the day of surgery. Most patients prefer to receive IV sedation during the procedure. You can discuss options that best suit you with your oral surgeon during your consultation. There are occasional side effects with the use of anesthesia, such as drowsiness, nausea, disorientation, and vomiting. Allergic reactions can occur with these medications and can also occur where the IV has been placed in the patient. Although extremely rare, there have been reported fatalities with the use of anesthesia. We want you to be aware of the potential risks. However, the drugs and techniques we use are very safe. Do not eat or drink prior to your surgery. This prevents nausea and vomiting during the procedure and is for your safety and comfort. If you are on medications, you may continue to take your prescribed medications with a small sip of water unless otherwise directed by the doctor. With the use of sedation, you will need to be accompanied by an adult and driven home after the surgery. In addition, you should not drive or operate machinery 24 hours following your procedure. Regardless of the type of sedation used in your procedure, we advise you to spend the rest of the day at home with a responsible adult available to assist you. Post-operative medications will be prescribed to help ease discomfort for a few days following the surgery.
No two procedures or patients are exactly the same, but during a typical removal of wisdom teeth, the oral surgeon exposes the third molar by making an incision in the gum tissue. When the tooth is clearly exposed, the oral surgeon usually removes the impacted tooth, sometimes in 2 or more pieces, including the root. The area is then cleaned and examined. Occasionally, the exposed gum tissue is stitched to initiate healing and reduce bleeding. The stitches will dissolve over time.
After your procedure, you will be transported to our patient recovery area, where you can relax until you feel you are ready to head home. We will give you post-operative instructions and advise you to take it easy for the next few days. If you are given an antibiotic and you take birth control pills, you should be aware that the birth control pill might become ineffective with antibiotic use. Therefore, appropriate precautions should be taken. Your reaction to surgery can range from mild to significant discomfort. You can expect 2 to 4 days of soreness after your procedure, and you may experience a small amount of bleeding on the first day of recovery. The use of ice packs and taking prescribed medications may help with the swelling and sore jaw muscles. Many patients are completely recovered by the 5th day following surgery. Some rare complications or unanticipated results can arise during and after surgery, such as damage to nearby fillings, adjacent teeth, or fractures of the jaw. There is also a nerve in the lower jaw that is often very close to the roots of the lower wisdom teeth. In younger patients, the roots are short enough that the nerve is not normally disturbed during surgery, but in older patients with longer teeth roots, sometimes the nerve can become irritated. Post-surgery, the patients may experience tingling or numbing sensation or lack of sensation in the lower lip, chin, gum, teeth, or tongue. In rare instances, these changes can be permanent. With any tooth extraction procedure, there is a risk of a post-operative discomfort known as dry socket. If dry socket does occur, it is almost always in the lower jaw, 3 to 5 days after molar teeth are removed. There is no known cause for this pain, but it can be due to a premature loss of a blood clot in the empty tooth socket. Patients usually notice a dull, achy pain starting in the ear and moving down towards the chin. Medication may initially relieve the pain, but eventually oral prescriptions will no longer work. To treat the dry socket, we usually have the patient come into our office, and we will place a medicated dressing in the socket for up to 48 hours. We can repeat this step several times as necessary until the patient no longer feels discomfort. It is important to understand a dry socket is not an infection. Although infections can occur, it is most common in patients who smoke or are taking birth control pills. The removal of wisdom teeth is a very common surgery that we perform almost daily in our office. We have an impressive record with these cases. Our skilled surgeons are very experienced and have seen a wide variety of patients. Please feel free to ask your surgeon any questions you have about your upcoming procedure.